Thank you so much for joining us. As MDI Health presents topics in modern medicine. This is our fourth series this summer and fall, and we're excited to be able to present not only in person, but we have quite a few attendees on Zoom. So wave to them; they can see us. We're happy that they're here as well. Part of what I'm Chrissi, Maguire, the president and CEO of Mount Desert Island Hospital Health Center for Retirement Village. And we are always so happy to be able to be part of this amazing community and be able to bring you important information about how we serve this community and what our strategy is. I want to call to attention to you, there's some information about the hospital and about our modernization and campus improvement project. If you haven't been by the hospital, you will certainly not recognize what it looks like right now with all the construction. A matter of fact, a few of us are still doing this after the county today. Deb, our chief nurse is in the back, and she's like, I don't think I can do this. And we have a ways to go, but we're excited about what the future of the hospital and our health services will be. This is important. The hospital is almost 130 years old. It has been an independent, dedicated, service-based organization for all of that time. We have no intention of changing that at all. And so today we're going to talk about something that's incredibly important and certainly has a fabric back to the work we're doing in our modernization project at the hospital, emergency services. As you can imagine, the importance of having access to emergency healthcare services in every facet of this island is represented here today. And we're very grateful for our attendees and our speakers who are here today, and I will introduce them. But when you think about, we thought about this yesterday, the bridge went out. We practice this scenario. We don't like to think about it, but we practice this scenario. And rest assured, there is actually a temporary bridge in Ellsworth that they can install in the event of an emergency. And we learned this information as we were doing some practice with our countywide emergency preparedness, especially during those storms we had a couple of winters ago, where I came over the bridge and it was a Saturday, and I look back and Thompson's Island is starting to flood over. And I'm thinking, what happens if I have to get somebody off this island? Now, I love LifeFlight, but they were not going to fly in that storm. But I can imagine them bringing the transport vehicle to that bridge and us figuring out, do you have a boat? Because we need to transport it. That's what we do. When we think about emergency preparedness, we are constantly thinking about how can we be prepared in any event and any emergency. And so what we'll be talking about is some of that today. We'll answer questions. We have a facilitator who will be here. Mariah, Cormier will be facilitating questions, and it is an iterative session. So we ask if you think about things, we'll have a microphone, and we are certainly happy to answer those questions or get you answers for those. And of course, on Zoom, we'll be monitoring the chat. I think Robyn's going to be monitoring the chat, and we're, again, excited to get this kicked off. Today, joining us in no particular order, but on my paper is the order, Dr. Damian Flowers, who is the director of our emergency services at MDI Hospital. John Lennon from the Bar Harbor Fire Department. He's our deputy chief. We lean into John a lot when we're doing emergency preparedness training. He is a wealth of information, and he's an incredible partner for all of us. And Stephen Powell, who is the deputy chief ranger for the Acadia National Park. They never have anything that goes on. And then Kyle Madigan from LifeFlight. Bill. Bill is here, Chief Operating Officer of LifeFlight. And I had such a pleasure a couple weeks ago where we were able to do the ribbon cutting of the new helipad that is strategically located in Bar Harbor. Many people have asked us, so I'm going to answer this right now. Why is the helicopter pad not at the hospital? Two reasons. We don't have enough space on our campus to incorporate a helipad, and our neighbors love us. They're tolerating us right now, but I can't imagine what that would be like to fly and land a copter on that space. And we can't put it on the roof. We don't have the structural soundness for the roof. So having it close by is an important location may not be considered optimal, but we are so grateful for our partnership with LifeFlight. And soon after, I think it was last week, the helicopter was flying routinely last week. So I'm grateful for all of you participating in this. We're going to get started. I'm going to pass it over to Mariah, and we'll start our conversation with these amazing thought leaders.
Awesome, thank you, Chrissy. So I'm going to just give a brief on how this will work. So thank you to the Southwest Harbor Public Library for hosting us. Thank you all for being here, and thank you to all of you for being our panelists today. So we're going to start with brief introductions from our panelists. They're going to talk a little bit about their experience, what they do in their roles and their organization's roles on emergency response and emergency medicine on the island. And then I have a couple questions to get us started, but I do really want, and we all really want, questions from the audience. So if you do have a question for our panelists about anything, whether it's role specific, organization specific, community specific, raise your hand. I'll come over with the mic so that the people on Zoom can hear us. And for the folks on Zoom, if you have a question, put it in the chat and I will call on Robyn. She's going to raise her hand and she'll ask the questions for you guys. So we'll get started with Bill's here at the end from LifeFlight.
Sure. Well, I'm Bill Sear. I'm the Chief Operating Officer for LifeFlight. I have been here at LifeFlight for about 5 years, but I've been in this industry of the helicopter transport for about 33 years. I worked in Boston for quite some time, and my job at LifeFlight is to oversee all of the operations, all of the clinical staff and all of the personnel that work for LifeFlight. Making sure that our bases are staffed and we're able to respond when we need to. We'll also oversee the communication center where all those calls go into, and then they make a decision on who is going to go on which transport. And we're located in Sanford at the airport, in Lewiston, Central Maine Medical Center, and then in Bangor here in just down the street. So, thank you.
John, you're next.
Hello, everybody. I'm John Lennon, the Deputy Fire Chief in Bar Harbor, and my primary job at Bar Harbor Fire Department is supervising the emergency medical services operation. The Coast Guard brought me here to Southwest Harbor in 1990. I got out of the Coast Guard and went back to the Army Regional from Albany, New York. I've been a paramedic for 32 years. I've been with Bar Harbor for 24 years. So I cut my teeth on the streets of Troy and Schenectady, New York. So it was a nice change of pace, transitioning into the Maine way of things. So Bar Harbor Fire Department, we're just a little cog in the wheel because there's 4 fire jurisdictions on the island and 3 ambulance jurisdictions altogether. So we're just a little cog in the big wheel to respond to emergencies.
Dr. Damian Flowers, thank you first of all for allowing us to be here today for this question and answer session. Thank you for saying 1990. I realized that I graduated medical school in 2006, and that means I got a big anniversary coming up here this year. So I did my trauma training at University of Connecticut and finished that up in 2009. I've been here for the last 5 years. Just recently this year, the emergency department medical director. Did you want our roles in the community? We're a 6-bed technically ER, but we've been operating at a much bigger capacity than that. As you can imagine, we utilize every hallway. We have what we call vertical beds. That's a fast track area where you can see less security stuff. And currently that's a 5-bed capacity, and that often has more than that. So depending upon what day it is. So you can imagine summer volumes much higher than winter volumes. But we're open 24/7. So we will remain that way as everyone. I know we appreciate your patience with the construction, but we'll be here for whatever your needs are.
Hello, my name is Stephen Powell. Good afternoon, evening, however you want to look at it, since we're sitting on the precipice of kind of the evening time frame. I am the Deputy Chief Ranger for Acadia National Park. I oversee the law enforcement emergency services aspect of the visitor resource protection branch that is in Acadia National Park. I've been with the Park Service for 20 years. I've been back here at Acadia for 6 months. I had a little spell, 2005, I started in Yellowstone, and then I worked here for 2 seasons in Bar Harbor. And then I went about my life, and I've been everywhere from California to South Dakota to Alaska, working for the National Park Service. And I've been an EMT for 20 years as well, coming from the Pittsburgh area. In terms of the National Park Service and the role in the local EMS scene, we are a national entity. Our mission is to conserve unimpaired the natural cultural resources and provide for the enjoyment of visitors now and for future generations. That's our mission. How does EMS and emergency services factor into that? In our law, it's mandated that we do have emergency services and that we partner with our local resources to protect those visitors that do come to the park. And also as part of that, we have the ability to operate outside the park in emergency situations to assist entities and if there's a mass casualty type incident or there's just need within the communities, we do have those abilities. We maintain 26 affiliates from an emergency responder up to the paramedic level, and we have a year round of 11 within the EMS role. So that's kind of how the Park Service fits into the scene here on the island. And we all are also on the Scoodic Peninsula and Isle of Ho, which we do serve those areas and communities as well.
Great, thank you guys. So I have a couple questions to get us started. If there's prompts any questions, like I said, in the audience, please just raise your hand, I'll come to you with the mic.
Could you sit right there?
Yeah.
That would be a great place for the camera goes. Thank you.
And I'm gonna stand.
Or stand
to see me, yeah. I'll sit. Yeah. So, and then you guys, I'll ask a question directive, but if anyone wants to jump in, obviously jump in, hand the mic around. But my first question is for Bill. You guys have been pretty busy lately, especially with the new helipad. Can you kind of walk us through when LifeFlight is called in? What does that look like working with the departments that are up here? How do you interact with various organizations step by step? What does that look like for LifeFlight?
Sure, great question. So we operate in 2 sort of different responses. One is referred to as a scene call, and that's when one of the emergency medical services agencies calls us. They have a patient that they know needs transported to the trauma center or a tertiary care center, and we would respond right to the scene of where that accident or injury is. The other part that we do is called interfacility transport. So that's from one hospital to another. And that's typically because the local hospital doesn't have the services available for that patient. And they call us to provide that transport. Our goal is to provide critical care transport for that patient and to provide whatever clinical care that they need without decreasing any critical care outside of the hospital. For many places in Maine, some of the very small critical access hospitals, we have more equipment than they may have or services. For example, in a small critical access hospital, they may not have respiratory therapy at night, or the lab may not be open at night. And we bring those things with us and be able to treat those patients right on the scene. And we can take patients from Bar Harbor here. Typically, we go back to Eastern Maine Medical Center in Bangor. We bring a lot of patients to Portland, to Maine Medical Center, and we bring a fair number of patients to Boston. It really depends on what the need is for that patient, where the appropriate level of care is. For example, if someone has an eye injury, the most appropriate place for them to go is to Mass Eye and Ear in Boston. So we will bring them directly there and bypass the other facilities around. But we work with many different agencies here on the island and throughout the state. An example is if someone were to be injured in the park and they were inaccessible, we would work with the Park Service, of course, and the fire department, and the forestry service that might come in and bring that patient from where the remote location is to the ball field, where we would meet them, take over care, and then bring them to the trauma center. Most of our calls are done right from the hospital, and they would call us, and we would respond, to the new helipad, which has been a great improvement for us. In the summertime or when the weather is good, we would land at the ballpark anyway. But in the wintertime, we would land at the ferry terminal. And so, depending on traffic, it's about 10 minutes from the ferry terminal to the hospital. Well, it's only a 20-minute flight to Bangor from here. So when we land at the new helipad, which is only a minute away from the hospital, we're cutting that time down where that patient can get the care that they need in a very short period of time. So it's been a really great project. It's been a long time in the making, and a lot of people involved in making that happen. And it's really good that we can now have a year-round place to land just a block away. So really good.
Thank you so much.
And Dr. Flowers, what are some of the biggest challenges in coordinating that kind of care? Like, Bill spoke to it a bit, there's a lot of, where do they go? How do they get there? And then you spoke to it a bit, there are days where people are in hallways and, you guys have a lot of overflow. What does that look like? And what are those challenges?
Yeah, I think, one of the main challenges is Maine. So it's a very large geographic area, right? So I'm often surprised at the services that we have here on the island. MDI hospital is a small hospital. We're relatively well resourced for a lot of the emergency care. But we are a critical access hospital. And I think the word access is it. So sometimes patients, because of their condition, it's better served elsewhere. So the barriers are things that you would think of, like the weather, right? So you can't fly a helicopter when the weather is bad. So that means ground transport. The bridge, right? So we had a little taste of that yesterday. Is that what do we do if the bridge is out? So you have to have a contingency plan for that. Just the number of people that we see in a relatively small, compact area, many pedestrians and traffic can sometimes lead to longer transport times. So you just need to be prepared for that. And, I think that we do a lot of the listening to my grandma and, save for a rainy day, be prepared for all things. And that's essentially why I lean on these guys. So it means a phone call. There's a lot of coordination that happens there. So what you probably heard was that when the weather is good, we land at the helipad that's real close to the ballpark here. When the weather is not so great, we might end up at the ferry terminal. Well, how do you get from the ER bed to the helicopter, right? That takes another crew, that takes another unit. So that's taking another crew out of service to just transport from RED to the helicopter itself physically. So I think one of the biggest challenges that we face is just manpower, right? So I think it's sometimes we may have, it may be 2 paramedics, on the island. What happens whenever you send one of those away to Lewiston, or you send one of those away to down to Portland or even Massachusetts? So, encouraging people to apply and come here. There's an education. So I think that those are all places that we can look at and improving the access.
And the improvement with the helipad being so close, it's obviously a timely improvement. And in addition to the improvements to the emergency department, and John, you can probably speak to this as well, what those improvements will mean for that transport for you guys getting into the emergency department with, and Dr. Flowers, for you guys getting people out. What are those improvements look like for staff, not just for patients coming in, but that handoff?
Talking here.
Either right. So go ahead. Okay.
Yeah, go for it.
Yeah, so the biggest improvement I think that everybody will notice is the space, right? So it would be easier to get in and out of. That's just access, right? Back to that access thing. There's a report given, I don't know if you're asking technically, like from our nursing staff, from our physician, there's a doc-to-doc report about the condition so that they know what to expect whenever they come. I think at the heart of it is this ER, one of the things that is my favorite piece about ER is it's a very much a team sport, right? So we have to rely upon each other, and the key to that is communication. So there was standardized ways in which we communicate with each other. And a lot of those things seem seamless, like they just happen, like there's a light switch, but really there's a lot of good communication going on behind the scenes.
Any questions from the audience? We'll pause and we'll, yeah. probably. I have a question from Zoom. You see many out-of-state patients, summer residents and tourists. What success do you have communicating with their home physicians and hospitals? And we can kind of start, I mean, I know that's probably primarily a hospital question, but really you all have interactions with patients, whether you pick them up in an ambulance, whether you interact with them in the park. So anyone can take it from any point of getting to know the patient, getting to know who they are, and getting them to where they need to be.
Don't all go first.
I can give you a part.
Yeah, let's.
At least from a park perspective, when it comes to visitors to the area or summer visitors. I think our main role when we interact with somebody in the park is just making sure that we are either finding somebody who they're traveling with, or that they have next of kin or something of that nature, to make sure that we're passing on the appropriate information so that their family members and their other entities, whatever they are, understand and know what has happened to them. I think that's a huge piece in parks. Is oftentimes, you know, we're a little bit more blessed here at Acadia because it's integrated with communities, and there's not so much, as we call it, backcountry in the National Park Service. But when you get into the bigger park units, Katahdin Woods and Waters is certainly one, 70,000 acres. When you start to get in these more remote environments, it's hard to communicate on and make sure that information gets passed on to family members, and that they can understand and track what's going on. So kind of that's where we fit in that piece of the puzzle whenever there's an incident that occurs within the park, and making sure that there's communication going on with the family members, because that's a huge key and piece when somebody does come into a bad way on the medical side of things.
Yeah, so from a hospital perspective, we have a new phone system. Thank you, Chrissi, and whoever put that thing in for us. So it really is as simple as getting on the phone with their primary doctor or with their specialist that may be at the other facility. There's the patient portal. So patient portal has access to the testing that we have done. It often in real time has access to the medical record. That's how doctors communicate with other doctors. Some people, if you're going to be able to be discharged from our facility, we have MRI, pretty cool, right? So we've got some capabilities with imaging that their usual doctor, which may be out of state, would be interested in. We have the capacity to put those onto a CD and send them right with them. So and we do that, and that important information gets into a packet if the trip is going to be to another higher level of care facility.
I think one of the things that we work with the families is when we typically see one of these patients, it's on often their worst day, and not their only worst day, but the family's worst day. So if they're here on vacation and something happened, we're now taking them far away, and they're not familiar with the area. We make sure that our teams also talk to the family before we leave, let them know what's going to happen, where they're going to go, how to get there. And if it's a pediatric patient, we try really hard to take one of the parents with us. It doesn't always work out. We always are working for making sure that we're doing things safely. So we make sure that if we can, at all costs, we take a parent with us, because that's really important for not only the parent, but for that patient too. So a young child who is in the middle of something that is not great, and they're heading into unfamiliar territory and they're really scared, the best thing that we can do is have that parent with them. So we try really hard about that. And then we'll try, our crews will bring the patient to the hospital, and typically they're there when the family gets there, and we help with the family getting them where they need to go and giving them more information. We always take somebody's phone number. So when we land at wherever we're going, we'll call that number and let them know how the transport went, how their loved one is doing. And what we're really trying to do is not have them drive 95 miles an hour to try to catch up with what we're doing. We want them to be reassured that they're in the best hands possible, and they're now in the best hands possible where we drop them off and how they're doing, and pass that news along.
Any audience questions? Any others? Sure. Here.
Yeah, I was wondering if search and rescue is represented under your jurisdiction. We see on the news where there, helicopters are taking people off the mountains, like more recently at Beehive, and taking them to the hospital. So that seems like a critical component. I'd like to hear something about that.
Stealing the thunder from I think one of the questions that I've got, but nonetheless, search and rescue certainly is sort of where I see the National Park Service being different from the other agencies here. Across the National Park Service, across the country, we have rangers who train, on El Capitan and in Yosemite, on Denali. So all these rangers tend to move around to different park units. And Acadia is no different. I'm an example of working in Yellowstone and Death Valley and all these different places to where we experience a whole bunch of different types of emergency services that are a little bit different because of the type of units. And so in Acadia, you mentioned Beehive being one. We do partner certainly with Bar Harbor, with other agencies to make sure that we provide the patient care in those areas. But for the most part, it's going to be the rangers, the law enforcement rangers who maintain emergency service qualifications. And we also have a 3-year young program known as the Preventative Search and Rescue Program. Their mission is to prevent search and rescues from happening from the start, with education, with being at trailheads, making contact with visitors, providing them advice on footwear, things of that nature. But certainly when an issue does arise up trail and there is a search and rescue circumstance, they are trained in that aspect of things. And when it comes to, the short haul missions that come off a Beehive or the precipice, we have general agreements as a National Park Service with Maine Forest Service, the Army National Guard, to be able to effect those rescues. And we do training with them to make sure that we can communicate on the same channels and conduct these rescues, as flawlessly as we can, and without further injury. So I think generally speaking, this is where the National Park Service really shines in terms of the EMS side of the island. It's certainly Bar Harbor is the one. If there was a call on the roadside, they're oftentimes beating us there. We certainly assist with hands and manpower and traffic type situations. But really, when it comes to the trails and being off in the backcountry situation, I give that quotes. I can't truly call it the backcountry in Acadia, but nonetheless, when we're off the road system, that's where the Park Service really shines in terms of being able to provide patient care. And I would say also with our PSAR program, we're attracting individuals with higher care qualifications. We have a paramedic on staff this year, and we're looking to take our capacity and raise the bar as well to provide advanced life support care in those environments. So we're also not taking away from Bar Harbor's capacity to serve in Bar Harbor and the rest of the town. So did that answer your question?
Yeah.
Excellent.
So this past, last week, I had a couple of questions, so I wanted to ask you about this, and this is not a political statement, but that many people are concerned that those services aren't existing on the island right now and in the park. Can you just speak that, yes, those core services are there, people are safe to be able to go into backcountry on Acadia?
Yeah, certainly. So I won't go into the details of it all, but know that in the National Park Service, within the visitor resource protection branch, there's several different branches, maintenance, all these different ones. But within visitor resource protection, we are all classified as either accepted or exempt, and regardless of paycheck, regardless of situation, we always work. And we will be there fulfilling the mission of the National Park Service and protecting our visitors and the resource. So, government shutdown makes no difference to us. We still perform our job and we're still there to service the visitors.
Another question, I think?
I know there was a patient in your hospital several weeks ago that was bitten by a tick in his own yard. And supposedly there's a new disease and he got worse and worse and worse. But it was over one of the holidays and all of the resources to flying or getting someplace else were standby. And the impression gotten by the news media that I saw was we all sat around watching him get worse until he qualified. Is there any way to avoid that in the future?
It's a great question. I don't think we have enough information to answer that, though. I'm not familiar with standby.
Yeah, so, I would just speak to, we're not gonna stand by and let somebody get worse, right? So that's really, that's probably the primary role of the critical access hospital is how do we set this person up to do the best that they can and get to the place that has definitive care that they need, right? So that's supportive care, meaning antibiotics sometimes, and we coordinate with the receiving facility. So if there's transport issue, like let's say there's a blizzard, there's a nor'easter and we can't get off of the island, and we don't physically have a neurologist and you're suffering from a stroke, that stroke care would be coordinated in conjunction with the neurologist at the specialty center. The goal to get them out as fast and safe as possible, but yeah.
Any online questions? Well, the one online. Are there any additional resources that you feel would enhance your capabilities to serve the community?
People, right? So skilled young people, I think that, unfortunately, the island has a people problem as far as attracting young skilled folks, right? So the paramedics are highly skilled, right? They can do things that a basic level EMT are not able to do, right? So attracting folks to the island that have either received that training elsewhere or training opportunities here, that would be the first thing that I would say.
Anyone else, the panel? Okay, Maria?
Thank you. I have a question that's a bit different. When I listen to each of you, and Chrissi, it's clear to me that we have a pretty significant capability and a lot of people eager and willing and ready, capable to handle an emergency when they know about it. So my question is, there are a lot of people who, a friend here in town, she fell and broke her leg. And her arm or something like different was, and she ran over to the community health center because she thought that was an emergency department. And that was obviously a delay in getting service. So I'm wondering if there is some opportunity for us from a community service perspective to make not only residents of our community, but visitors more aware that should something untoward happen, this is what you do. You might call 911, but you do a lot of other instinctive things that may not be what they ought to do. And is there some way we can convince them, go to the emergency room, they'll call the park service, or they'll call the fire department, or they're gonna call you, but we don't LifeFlight, someone else will, but great resources, but you have to know they're there and know how to contact.
Part of the fire service, we do a great deal of public education. We went to the town, we go to housing facilities, and we do engagements such as this, and we talk about just that stuff. Call 911 if there's ever a problem. You know, back in the day, and I know it still goes on these days, people are still calling the 7-digit number right to their dispatch, because, you know, that's the same phone number they've known for 50 years, right? You know, and, you know, when you call 911 and we gotta, you know, educate people, you get instructions from the emergency medical dispatchers to start implementing care for yourself even before emergency services arrives. So part of that, you know, when we're out educating the community, is, you know, access 911. And we also talk about, you know, stroke awareness and stuff of that nature and other services, to better help yourself too. So, we do, and you're right, it still happens though, but, we just gotta continue getting that word out that, you know, when emergency presents, call 911.
Should it be in the park newspaper, should it be a rooming service where people rent rooms, I don't know how it should be, but it just seems to me that if more people who had an emergency knew there was what to do, with that, there was something to do, our community would be better served.
Yeah, I was gonna say that, the answer is always 911. You know, there's some difficulty in, you know, what's an emergency. You know, if we pass this microphone around the room, I think we may get variation in answers. And one of my favorite things to say is, if you're concerned, I'm concerned. Right? So, if you believe it's an emergency, that's why we're open 24/7. And if you dial 911, we'll get you there. Right? So it'll be one of these guys and we'll get you to where you need to be. So.
I'll just say as an addition, you know, calling 911 also does provide coordinates for your location as best as it possibly can, which again, in those more remote situations, or if you're unable to describe where you're at or those kinds of things, that can lead us to that. And, you know, once a call goes into the EMD, the emergency medical dispatcher area, they triage those calls and put them to the agencies responsible for those, for the medical response. And that is the best place. That is the best service to be able to provide. You know, every once in a while, we'll get a call direct into our dispatch. It's not that they can't handle those calls or they can't figure out how to dispatch those things. It's just a much smoother process when it goes through 911. We get coordinates, we get everything, we coordinate among agencies of how we're going to access. And I mean, that's going to be the cleanest way. There's other ways, but either way, I think the take home is to rest assured that somebody's going to be coming.
Following up on Ed's question, Don, is there anything done with the hotels and mainly the hotels, you don't have much control over the Airbnbs, that could get the information out about the services?
We have met with staff in the past. And talked to management and stuff of that nature. And their literature does, you know, in your room card and stuff does say call 911. And we know it works because usually in a hotel, you're dialing a 9 to get an outside line, all of a sudden they're dialing 911.
Right.
And it's calling here like, this isn't room service, you know? You know, so we know, you know, so we know 911 works from hotel rooms. So I think the word is out there. And I think from, and again, you know, 911 being a national, you know, thing that a lot of people do use it, but there is, again, you know, those folks who still like, you know, they like to call that local number and know that if I'm over here in the library having a medical emergency and I'm calling an ambulance, I know they're answering right across the parking lot. If I call 911, you know, the regional communication center in Ellsworth answering, you know, and again, that's where you get all that technology. We can see your location and all that stuff as well too. So, you know, we just gotta get people to call 911. Yeah, and there's literature on the table I put over there too. Chrissi sparked my memory about a little snapshot on emergency medical services for the whole island and about what's provided. So I made 25 copies.
Great.
And I'll just add from the hospital perspective too, we have cards at all the hospitals and we have, on the TV screens that run too, there's an ER ad and ED ad and, all the front desks have ED information as well, so. They have our information too, but you're right, getting as much and as many, cards and info out there is always good. Good question.
Thank you. My name is Ken Colbert, and I am that sick patient.
I witness.
I would like to paint a little bit different picture. Because my experience was when my good wife Jackie took me to the ER. I subsequently ended up at EMMC, and the first thing they did was run a catheter from my chest to my heart and deliver me 5 units of packed red blood cells. Because it wasn't just a regular tick or Lyme disease or anaplasmosis, it was babesiosis, which is a parasite like malaria. So it was eating my red blood cells, going after my liver, going after my kidneys. After that, they did the antiparasitics, and after that, I did dialysis. But my picture at the emergency room is a little different. Because the emergency room, Gordon Murphy and Christina stabilized me, got me IV, talked to Bangor, got me a bed, asked anything else they could do for me here. So they did everything they could. But the picture I want to bring is that the transport to Bangor was the problem. This was the Saturday of Labor Day weekend. Not an easy time to get a ride. LifeFlight didn't want me. I guess I had 48 hours instead of 24. I'm not sure what the standards are. Kristen called 25 ambulance services twice. So the picture I want to paint is not one of care, but one of patient persistence. Had it not been for her in Gordon, I don't know where I would have been. I was IV'd, I was vitals. Jackie couldn't pack me in the car and just rush me out to Bangor. Fortunately, John, your guys, Paul and RJ, finally said yes. And the Bangor, and the Bar Harbor Fire Department took this Bar Harbor resident up to EMMC. So I'm deeply indebted, yes, for your care, but as much for your persistence. Thank you.
You're.
Thank you.
I just wanted to say you look great. So, yeah, I love hearing those kind of stories, right? The piece I don't love is that there was a delay there. Interfacility transport is certainly an area that we're looking into. I know there was a question about search and rescue earlier, and one of our search and rescue members is also an ED physician, and she just accepted last month officially now the EMS medical director, and I know she shares some time with the trauma center up there. That's Cecily Swanburn. I think I can say her name. Sorry. But I know that that's an area that she's interested in looking at, is how do we improve that? Does that mean we need another one that's just dedicated to interfacility transport? It's the challenge, right? Is that there is a responsibility to answer 911 calls. So what did we just all tell you? Dial 911 if you have an emergency, right? And we need to have somebody who can respond to that. So we can't take that if there's 1 or 2 units away, right? So that's a problem. I'm confident there's an answer to it, and we're actively working on that. So I appreciate you bringing that up.
I'll add a little bit to that perspective as well. So one of the other things that I do, I'm on the board of directors for Maine EMS. And the issue that you unfortunately were part of happens throughout the state. We have patients that need to get transferred from one facility to another, and that facility can take them. And, LifeFlight's role in that is taking the patients that need critical care transport in a rapid fashion. John's role in EMS is serving the residents of Bar Harbor and being ready there when someone does dial 911. And what happens is that the people in the middle get caught, like yourself, because the interfacility part, when you need a ride, you can't go in your own car. But at that point in time, you don't need a helicopter either. And that's where the challenge is right now. And really it goes back to what Dr. Flowers said was the staffing. We can't get people in the state that want to work in that line of work, or if they do, they only work for a short time and they move on for something else. And it's a real challenge. And it's not only here on the island, it's throughout the state where patients sit in an ER for days waiting for an ambulance that can come and get them. And part of, our communication center does cover a large portion of Maine for ambulance services, and they call us frequently. And some of those ambulance services that also, like Northern Light Medical Transport, which is a private ambulance through Northern Light Health, they do interfacility transport. They also cover the 911 calls in Ellsworth, and they cover the 911 calls in communities surrounding Bangor as well. So they have to have that level of service available. And unfortunately, it's patients like you that get stuck there and don't have a service. I know that the communication center constantly are looking at that and trying and calling, and we call all over the place to get patients transported, but it's a crisis in Maine. It really is. In other states as well. It's not that much different, when you have, if you're in the Boston metro area, there's a lot more ambulances, a lot more patients, and the same thing happens. And it's unfortunate, but that's the reality of it is there's a problem with the system. And we are trying to fix that as hard as we can, to find the staffing, find the services that can provide that intermediate or lower level care and get people where they need to be so they don't get sicker. That's the goal, right?
Yeah, I just wanted to build on what you all were saying, because it is a crisis in the state of Maine, and we have elevated it to a strategic level with the Maine Hospital Association working on this, the Maine Municipal Association, the Maine Medical Association. We recognize it. When we get ambulances from Howland, Maine, to come and do our transports, we are grateful. First of all, we're grateful, and we understand the commitment has to be towards those emergency calls, but we have to figure out how best to use our assets. We have significant amount of assets throughout this state, and it's the staffing. How do we incentivize the staffing? In Caribou and in Aroostook County, they came up with a very unique model that we are trying to see if that will work, looking at a intermodal transport network where we know where the assets are. Are you empty? Can you pick up this? Can you take them there? So this work is being done. It is not being done rapidly enough, but we continue. Tomorrow I'm at the State House, and this is one of the topics we're discussing, is how do we care for our patients and ensure access to services? And this is part of what we are going to be discussing as well, but it is a crisis. We agree.
Good. We've been working with the hospital for years now, trying to, combat this, this interfacility transport problem. For those who don't know, and this is where our dilemma lies sometimes too, because not only do we provide emergency medical services, and I'm talking just the town of Bar Harbor now, not the other jurisdiction on the island, but we also provide fire suppression as well too. And, depending on staffing, we could have between 3 or 4 people on a shift at a time, which by national fire protection standards is not enough by itself. So we're getting by with skeleton crews on a normal basis. And just Friday evening, we went down to take a patient from the hospital, and the ambulance got to the hospital and a structure fire came in up on Route 102 in Town Hill. And the ambulance had to leave the hospital and go run back and get on a second fire truck and go so we can put out the fire. So that's a little bit of a dilemma there. We do try, and again, it's staffing. We try to, in years past, we'd be able to have someone off duty come in and do a transfer and stuff like that, but those things just don't happen anymore. And it's a balancing act. We're working with the hospital. And when those patients really need to go, you know, we try to balance that, well, this person really needs to go, you know, we will do that transfer. So it's a balancing act and it's a roll of the dice.
It's also an opportunity, right? So, you guys have the ears of the young folks in the community. Whenever you see these, you know, someone who's smart at graduation, who maybe says, not entirely sure what to do with my life, go to Maine, become a paramedic, set up an inter-facility transport service, and we will put you to work.
And we'll be busy all the time.
Yes.
Sort of a follow-up question, I'm not sure if we can answer this, from the Zoom, it says, does Southwest Harbor and Tremont, ambulance have a paramedic on staff? I noticed that the Stonesville ambulance seems to come down to Southwest Harbor for many calls. I assume this means a paramedic is required. If Southwest Harbor doesn't have a paramedic at this point, is there a risk for patients, for example, in Tremont, who need a paramedic but will need to wait an extra 10 minutes to receive higher level treatment?
Well, I can say that all the ambulances on the island and the way the licensing goes for the state of Maine, all the ambulances on the island are licensed at a basic EMT level. And through licensing, we're permitted to the paramedic level. So we don't, we're not required to have a paramedic on every shift. Our goal is to have a paramedic on every shift. Sometimes we have two. But when staffing, someone calls out sick, someone's on vacation, you know, and we have to have someone come in and fill in, that may not be it may be a basic EMT filling in for a paramedic who's out sick now. So, and the way the scheduling goes, you know, I don't, you know, just knowing, how Southwest Harbor operates, you know, they may have two EMTs scheduled for that day on shift. But again, and it's part of our mutual aid agreements, all the island agencies will work very well together. And Mount Desert Fire Department will come to Southwest Harbor to provide intercept with the Southwest Harbor ambulance to provide a paramedic. Bar Harbor has, and Southwest Harbor's responded to other towns to do the same as well too. I know just the other day, the crew in Southwest Harbor was actually on a call. And a second or third call came in. So Mount Desert and Bar Harbor both came to Southwest Harbor to do those extra calls. And again, and we all cross lines, you know, to help each other out. It's all part of our mutual aid. We've been doing it forever. And I'd like to say that's how we shine, is when a 911 call comes in, it's on Clark Point Road in Southwest Harbor. We're just getting in the truck and going. We're not asking why, or we're not asking, well, where's Southwest Harbor ambulance? We're going. So you're gonna get a very capable EMS crew, no matter what town you're in, anywhere on the island here. And it could be a red ambulance, or it could be a yellow ambulance. You're gonna get the same amount of service, no matter where you are. It may be from your neighboring town, so.
Yeah, absolutely.
You know, the National Park Service isn't in the transportation side of the EMS on the island. But what I will say in this conversation is, you know, paramedics aside, if you have a really good trained EMT who's knows what they're doing and has been doing it for a while, or is just really skookum with it, they can provide and save lives. It's not just paramedics that are saving lives, it's the EMTs doing basic care. It's the nuts and bolts of emergency service and medical care that will also save a life. So, you know, those EMTs that are working hard that stay at that level, they are providing solid, sound care that's also saving lives. And oftentimes it's getting to definitive care that's the biggest thing that's important in those emergency situations.
Yeah, I was just wanting to point out and hope that everybody notices that this is a team thing, right? So Mainers are resourceful. You know, if you don't have milk, knock on your neighbor's door, right? So we do what has to happen to get things done. We have even had to send ICU level nurses on with a basic crew to transport. You know, that's less than ideal because that's taking an ICU nurse out of commission for the transport time. Same kind of thing, but we work together, and that's where the communication piece is. So, if you know good ICU nurses, send them my way.
I was gonna add, cause Steven said, I should have thought of it, but Steven thought of it, he triggered something. So, yeah, a paramedic not being on call, you know, like Steven said, if you have a strong EMT or a strong advanced EMT, that's the middle level. The main, we operate by standard statewide EMS protocols. And over time, Bill's on the board. These protocols over time have been expanding at the lower levels, allowing those lower levels to do more. So in those times, maybe a paramedic isn't available, that EMT or advanced EMT with you is able to do so much more now to get that advanced care going.
With the passage of time, things have accumulated, so bear with me. Chrissi, thank you for your update on advocacy and where you're going to Augusta. I think you should think of us as junior advocates. We're here today, we're interested, we're learning, and we're going to have an opportunity in the next 12 months to be interrogating a lot of people who want to be making policy decisions. And if we're equipped with the right kinds of questions and the right kinds of deficiencies to bring to their attention, we're going to have better conversations in our communities about this particularly critical service. So I applaud you for what you're doing, but don't hesitate to mobilize these troops as well in the future. A quick question for the Park Service. You emphasized 911, and I understand it completely, but we also know, and I'm willing to be informed, educated, there are zones in the park that you can't get service. So are you all aware of that? And when you're meeting people at trailheads and such, are you alerting them that they're in a place where they may have a great difficulty getting in an emergency, getting a message out for help?
Yes, that is certainly the fact that 911 or cell phone service doesn't always exist in all the areas of the park. I will say most phones and technology this day and age, and soon to change here even in the future, where you have phones that are connected through Starlink and satellite type capabilities, do have the ability to text 911. And also phones will also boost your service level to potentially link into the cell phone system to be able to provide a 911 call. So there are some more advanced technologies as phones continue to get more and more technical and advanced of those things. But you know, sometimes it's to answer your question on our especially our PSAR, Preventative Search and Rescue Group out. You know, if it's not part of the conversation now, which I know it's talked about as they're having conversations with individuals at trailheads, it certainly can be and will be a part of that message. And sometimes that comes down to the other visitors and other people in our areas that are just that message board to get out to an area where they do have cell phone service, or they can contact the ranger in the area, or volunteers that happen to be in those areas to use our radio system to be able to call that information in. And sometimes it's that tried and true kind of telephone game. It can be dangerous, but it's also very effective as well. If you can find somebody and they can run out to get cell phone service or let somebody else know, that's almost as effective as calling 911 as well if you can't get it.
Just one more, because I want to end on a positive note. So I'm fortunately have never needed the services of the ER. But I was a witness with a friend who was there and awaiting transport on the helicopter. And I just was so impressed with the caliber of the ER staff, the manner in which they communicated with the patient and with me. I was not the husband, but I was perceived to be the husband. And then when the helicopter crew came in for the transfer, the manner in which they dealt with the patient and their protocols themselves, just very impressive. I couldn't be prouder of any service in Maine than I am of LifeFlight. I think we are blessed to have you and the caliber of your personnel and the commitment that you've made. And thank you for being on the board that's dealing with standards. Those are critically important responsibilities.
I'm Alan Maguire, and I'm on the board of a local ambulance service I just wanted to let people in Southwest and Tremont know that having higher level licenses is an important part and is preferred in our scheduling. Unlike Bar Harbor and Mountain Desert, we don't have dedicated staff. The providers come to us when they have time. And we, if there is somebody, a paramedic or advanced EMT available, they will most likely get whatever time they want. I also want to address the second topic, which is of transfers, either going to another medical facility or sometimes even just coming back home. Sometimes people are waiting at the hospital, waiting to get back home, and they need an ambulance to get back home. And that's also something that we try to provide by providing a bonus, you might say, or higher pay to the providers that come in off duty and take those calls. So like we did one, I think two actually, just this last weekend. So it does happen. It's a little different model than the other transport services, but I don't want you to think that somehow in Southwest you're not getting the same level of service.
Exactly.
Thanks. Coupler, just wanted to put a little perspective on all of this. I started practicing in Southwest Harbor in the early 80s. And what was interesting was in the early 80s, there were actually many more young people and families living and working on this island because there was housing. And what developed around here was there were many more people who just volunteered. They had as much training as people were getting in the 80s, which was sometimes really good and sometimes just grab and go. You know, it's better not to leave them out in the bush someone. Over time, it has become so much more organized, better trained and followed, but it was all volunteer up until not very long ago. And so it was as good as possible. You know, a call would go out and Jitterbug, known as Les White, would show up and drive the ambulance. And they'd have to make a decision by Sonesville whether we take this person to Bar Harbor or Ellsworth. It was like a discussion in the back of the ambulance. All of this gets worked out now, long way in advance. Things are much better prepared. So there's still a ways to go, but it's very impressive how much this has changed. And the communities are understanding that you have to hire every single one of your firemen. You have to hire every single one of your EMT people because volunteerism just doesn't work anymore because the population isn't here being supported for that. So we have benefits and there's a real change in this community and changing probably most communities where there's seasonal and disparities. So we got some good with some bad, and if we remember what it's like, it's sometimes worth thinking about. What do we do? We did lose some really critical things that helped this community. And let's see what can be revived and what just gets rolling into history.
Can I just add something really quick? We talked about some staffing and just EMS in general and the difficulties of getting that staffing. And one thing I wanted to put in here, and I believe there was a question about it that we didn't get to, and that's just the appreciation of what emergency services does to somebody who's providing care in the field. We see things that you can't unsee, and to provide resiliency within our workforces to be able to maintain an individual to go out there every day and go to these calls is huge. And, you know, that's a battle I think we're constantly facing of how we can try to feed in each of our organizations to uphold our responders and make sure that they're getting the mental health services and the things that they need in order to go out and serve the public. It's one thing that doesn't get talked about very often. You know, suicide among emergency responders, it has been high and continues to go higher. And that's again because the stress It's, you know, your all times of night and day, your lack of food, lack of sleep, all the different things that go on to it. And again, you see things that you cannot unsee, and that has a way of you know, having a toll on your body, year over year over year, especially through a whole career. And I think that's a difficulty that we all face that I don't know that we know the exact answer on just yet. And so that's just one thing I wanted to make sure that I threw out as just an appreciation of what goes into emergency services.
Thank you.
Certainly a very good note to end on, and I'd like to thank all of our panelists and for your service and for participating. It's an incredibly important discussion. And it helps us unpack what we need to continue to do and work on, but it also helps strengthen the health and vibrancy of this community to know what our resources are, that we're all here together. Thank you for your comments about making sure that how do we make that web of connection and strengthen how we work together. It's a very important thing. I will tell you, there are areas where we need to improve, and the interfacility transport area is a huge gap for this island and other areas. But for MDI, it does seem to be a bit more of a struggle. So again, we thank you for being here. But on another note, we do have a sign-in sheet, especially for advocacy. We have an advocacy listserv. We'll be hosting an advocacy breakfast once we have more of the legislative activity underway. And we encourage that you would all join us, and I'll give you an update of where we are, both at a local, state and a national level of those impacts that are having. And there is a brochure here. I want to show you the one thing that Damian didn't say, and I want to show you. And John, they get their own ambulance entrance in this new hospital facility. Right?
Saving some so we could do this again.
Yeah, absolutely, absolutely. Well, again, have a wonderful evening. Thank you to the Southwest Harbor Library for hosting. Thank you for our panelists.